Hello, everybody. This is Deanna Minnick. Welcome to the Detox Summit. Today, our special guest is Dr. Kristi Hughes. So when I think of Kristi, I think of a couple of different words that come to mind, especially because I've known her for about 15 years. So words like trailblazer, international, entrepreneur, and patient educator come to my mind. And also, she's a very warm, kind spirit and really has been in the field of medicine for quite some time, especially working in the whole arena of functional medicine, which we have talked very extensively about. So let me just give you a quick thumbnail on some of the things that she's doing. She's an associate director of medical education for the Institute for Functional Medicine, and she's been doing that for just about 4 years. And she's also the co-developer of First Line Therapy certification. This is a program where people can learn more about how to implement lifestyle into their practices. So Kristi is not only a healer, but a teacher in many ways. She teaches the healers. She teaches the health professionals, and she's also in clinical practice. She's the founder of the Dynamic Healing Center. Her practice is in Alexandria, Minnesota. And so she has a very robust clinic and sees patients and does detoxification on a regular basis with her patients. So welcome, Dr. Hughes, to the Detox Summit.
Well, thank you for having me. It's an honor and a privilege to be here.
Well, we're so glad to have you, especially because you have so much experience and this is something that you're very familiar with. And you're so entrenched in functional medicine. So, what I'm pretty curious about, and I know you quite well, but I'd like to hear a little bit more about your own personal journey as to how did you get to where you are now?
Well, and I would probably limit that discussion to this realm of detox because I really feel that it's front and center and core to how I've grown as a practitioner and the way the movement of my entire practice has evolved. And I think the real big eye-opening experience for me in the last 20 years is that the question really isn't that, are we potentially, could we be, if we are toxic. I think the real key question that's really emerged for me in clinical practice is how toxic are we? And my practice is in the middle of Minnesota, and we are right in the middle of the hub of agricultural communities. And, literally, if you look in every direction, for hundreds of miles, it's agriculture. And from my experience in working with patients over all these years, what I have found is the most important critical thing that moves the needle on supporting a patient get to the next level or even platform for healing is to take the appropriate time to clear this level of the toxic body burden, to be able to allow for symptoms to fall away, for a clear picture to emerge, and to be able to truly differentiate between what was the body burden versus what is the true deeper clinical pattern to see. So I would say my detoxification journey really did begin with a huge eye-opening experience for me about 15 years ago. I have a family member who's very close to me who has Guillain-Barré syndrome. And he was an individual who was living in the Northwest, actually in Portland, and was out loving nature, working in nature his whole life, and took a job working for a company that supposedly was, doing all organic work. So it really connected with his level, his resonance, his desires. And I was given an opportunity to have a big promotion. And in that promotion, he was asked to start spraying chemicals and compounds, herbicides, pesticides, and insecticides, and was basically given, a double in wage, So he jumped on it, took this opportunity. And, what happened over the next 2 to 3 months was really profound. And swelling lymphadenopathies, mental, emotional disturbances that had arisen, and shifts in anxiety, severe anxiety disorders and neurological complications followed that particular time frame. And for me, the challenge, I was already a naturopathic provider at that time, thought, oh, well, let's just, use some of these vitamins, minerals, nutrients, dietary approaches, and, we should be able to get things back on track. And what was really stunning and shocking to me was that he was never able to get back on track, ever, again. And which led to the next layer of deep exploration into his genetics and looking at his detoxification enzymes. And it was really quite remarkable to find that he was unfortunately burdened with inadequate levels of enzymes to be able to clear herbicides, pesticides, and insecticides. And really, what happened in that 3-month load, that exposure built up his body burden to a point where it created permanent damage to his neurologic system. And I've always been one of those people who, tend to say, spontaneous healing is possible and miracles happen, because I see them. And, just seeing people in your life so close to you, that you know so well, experience certain levels of permanent damage that truly doesn't actually ever go away. Those are things that somewhat penetrate you or rock you to the core. And so my whole perspective shifted, over those couple years when I was realizing, the certain level of body burden and neurological insult or neurochemical insult that is out there, can truly not only change an individual's life forever, but that of family members, those who are close to them, and really completely shift the trajectory, of someone's life path. So I think that experience drove me deeper and deeper and deeper into understanding personal detoxification needs. And, I know this, Deanna, that, once you start to lift up that hood and start digging around, you find that the more questions you have and the more answers you find, the more questions you come up with. And then there's more answers you can't find, which leads to new layers of questions. And, it's led to 15 years of my interest in detox. And what I think about my patient base in the Midwest is that they are under an unbelievable environmental onslaught of various different chemicals that they can't get away from. They literally cannot get away from them. We have found lead in our well, and we live out in this pristine area, far away from town and industry. And, we've got a leaded well, in the middle of this gorgeous area in central Minnesota in this lakes area. And for me, this discovery and this journey, continues to tie back to my own life, my own family, my kids, growing up in an area where there's lead in the water, there's lead in the wells, there's, this exposure load all around. So, I've gone through 4 pregnancies, in the last decade, which then pushed me even deeper and deeper and deeper into this level of exploring the environment, as well as going on to look at your own personal vulnerabilities. So I always love to have my patients use the scorecard.org site just as a starting point. That's actually, going out to scorecard.org and putting in my zip code. I thought I lived in this beautifully pristine area, and I was absolutely horrified to see that our lead levels in my county were in the 80th percentile of risk. And, the reproductive risk concerns were in the 80th percentile. I just thought, how can this be? I'm not living in this metro area, or there's no toxic dumps, in my region. And to step back and say, this is a vacation land. People come here to relax and enjoy the lakes. There's hundreds, there's over 600 lakes in our county. It's this beautiful, I love the movement of the water, which to me made me feel like, the land would cleanse itself. Unfortunately, all these contaminants have really found their way into the water system. So through my family's journey, my 4 pregnancies and my prevention, and dealing with hundreds and hundreds of patients, often from the Midwest, but in many other areas around the world, my respect for understanding the body burden and the relationship to toxicity has really transformed the way I practice, the way I approach nutrition, the way I look at certain various different nutrients, medical foods, supplemental support. If you would have asked me when I graduated from medical school 18 years ago, if I thought that everyone needed to use supplemental support, I would have said, no, you can do quite a bit of this through food. But now today, 2 decades later, I do not believe that patients have the capacity to handle the environmental load that they live within, to truly be able to manage and work with their own genetic susceptibility without very carefully considering their own needs for a personalized approach for their own longevity, health, and wellness.
So, Kristi, this genetic susceptibility that you're speaking to. So, I'm thinking back to the story of this loved one and how they were really imprinted by this situation and it feels like it's more permanent. How do people find out about their genetic susceptibility? And is it possible that we could have irreversible effects of these toxins? Or is there some way to unlock that door eventually, just assuming that we continue to search for the key?
Well, what I've used in my practice, and granted, there are different resources like 23andMe and ways in which the consumer can go out and really gather some of their data on their own genetic levels or their own single nucleotide polymorphisms and such. I have really come to respect and appreciate the data that comes back to me clinically from a lab called Genova, and they have a detoxy genomic panel. And I use this quite a bit in my most chronically ill patients, especially those who have chronic pain and fatigue syndromes, classic fibromyalgia patients, neurologic disruptions, those with neurodegenerative conditions and states. So I tend to use the profile so that I can look at the known associated cytochrome P450 enzymes, and this would be what's called phase 1 enzymes, to be able to get a better sense of where some of their key susceptibilities are. And mainly for a couple of reasons. One is, what can we possibly do to lower their exposure? How can we change their environment and reduce the exposure load that they may have access to? And then second, what might we need to do to adjust or support the regulation of those enzymes in any way possible through food and nutrition? And then those profiles also open up for us some key data points around levels of susceptibility or inactivity or underperformance in these areas of these liver enzymes that are involved in packaging, bundling, and removing various different families of chemicals and compounds from the system. So for this particular family individual, it was very interesting. We were able to uncover and detect some of these relationships to estrogen metabolism concerns. We think about all these very xenoestrogens, that are present not only in the environment, but in the associations with plasticizers, and as you know, the list goes on and on, as well as the imbalances that showed up in his both methylation and what are called his acetylation pathways. So that's one area that I really do like to explore because that gives me some key guidance to move beyond just the baseline foundational food and nutrient needs, but to look at more long-term options for interventions, and strategies to be even more preventative considering other tissues and their susceptibility. The other profile that I use in very high prevalence with many of my patients is called a Nutra Eval. And this is a very comprehensive nutrition assessment test. Really, I wasn't using this more than 5 years ago. It's been in the last 5 years. I've now been using it with hundreds of patients and absolutely thrilled with the clinical insight that it provides, especially in these areas of oxidative stress and actual markers of glutathione, and looking at red blood cell levels of metals that could be present, or what we would refer to as toxic elements or toxic metals in the body. And then having this opportunity to take those risk factors, which we would certainly look at as our genetic predispositions, and now look at the blood work and the urine results showing us phenotypic expressions, or how the body is expressing and truly living in a day-to-day fashion, as well as then being able to look at key vitamins and minerals and antioxidants, essential fatty acids, and digestive components so that we can truly take them to a higher level of personalized care. So, there's no question I have a portion of my patient population that either can't afford to do that kind of testing or their insurance won't cover it. And, in those scenarios, we still have some pretty advanced tools to work with. I sort of fall back on my insurance policy, which is I work with a detoxification food plan where we spend, incredible amounts of time teaching patients how to balance not only their macronutrients, carbs and proteins and quality fats, but also taking the time to understand that there are some really powerful therapeutic foods that they can make a part of their daily routine, and we break down the different families of vegetables. We look at fruits, we look at these categories of live food in which we can really draw on and pull into the diet key foods that can have a very positive effect on bringing a healthier level of balance and function to the activity of these enzymes.
So you're talking a lot about the foods to include and the foods with medicinal impact. Are you also referring to something like an elimination diet where we remove food triggers so that we help the body to repair and that the immune system can get stabilized in order to help things like the liver and the gut to work better?
Absolutely. That's actually my first pass. And it is that, we know that the gut is such a large contributor to endotoxins or internal toxicity. So, where I like to have patients begin is removing the toxic exposures from their environment, right? Reading labels, reducing chemicals, keeping their foods away from plastics or plasticizing agents, and really going for pure, clean, organic, untainted foods where possible, and then moving into an elimination diet, which is very commonly implemented for around a 3 week or a 21-day rotation is very standard. And following that time frame of purifying the body of the most common food triggers, and as you mentioned, this is called an elimination diet, I will then often transition patients onto a detoxification food plan that will actually shine the light on and highlight these therapeutic foods that I want to see included in their diet from that point forward. So I like to see them move through remove from the environment all the potential triggers to lower the body burden. Let's include inside of that these triggering foods. So, working with an elimination diet approach, and then slowly start to reintroduce key foods in time to see if they're really there as triggering agents. And so, there's a very strong overlap between an approach using an elimination diet and the approach using a detoxification food plan. And I look at the elimination diet as a valuable thing to have people do once or twice a year, just as insurance to really clean up the signaling capacity and the health and wellness and restoration of the gut. And in between, I rely on the detox food plan to give them guidance in the area of the types of foods we want to have them maintain as a part of their daily food regimen that will support enzyme balancing and adequate, appropriate food as medicine.
Great. So, what I'm hearing is that there's a little bit of a sequence that you're describing that you do with patients. So, you start them out on an elimination food plan. So, getting rid of those food triggers, and that usually lasts about 3 weeks. And then after that, transitioning them to a more longer term maintenance plan that you call the detoxification food plan. Can you talk with us a little bit more about supplements? Are people on supplements all that way? So even after they do the elimination diet, and what kinds of supplements for an elimination diet? And how do they continue on with nutrient support even after?
Well, usually in that first phase, when we're doing an elimination diet, I often use the term GI cleanse, or this is a phase where we're doing a bowel cleanse with the patients. So I'll support proper, ideal, optimal digestive function. That may come in the form of healthy levels of fiber, the use of probiotics. Sometimes it's also improving in that phase digestibility, which could mean hydrochloric acid, could be working with digestive enzymes as well. And so, looking at that particular first phase, if I know that a patient may have endotoxins that could be stemming from some form of potentially a yeast overgrowth or pathogenic bacteria or a small intestine bacterial overgrowth, known as SIBO, as a part of that phase of that GI cleanse where we're following an elimination diet, I may have them at that time also using the components, typically botanicals is what I will work with, that will help to reduce, some of the infection load or the endotoxicity.
Mm-hmm.
Now, most patients who are not complicated cases, I stick with the basics: quality water, probiotics, fiber, and potentially maybe a green drink, to support them going through the elimination diet process. When I want to take a higher approach to reaching the liver detox capacity, in addition to managing the gut, well, then I shift to a different family of nutrient combinations. And in particular, my anchor in my practice, really the stabilizing factor for healthy detox for me, has been one of the ultra clear products. And I will typically detoxify comfortably. I could say 95% of my patients, I'm using Ultra Clear Plus, which is a medical food that has a wonderful balance of micronutrients and some key components related to supporting not only liver and kidney function, if I'm looking at specific pH balancing needs, but I will typically utilize that as a base, and then I anchor that to another product that brings in important botanicals to support the liver and the detox cascades, and that's called Advoclear. So I will use the two of those as a step process where I'll have them working their way up and slowly increasing, gently increasing their doses over the course of, basically a 10-day window, so that we then hit a peak point and we're fasting for approximately 3 days. And when I say fasting, I mean no food. In that stage, we're using medical foods, we're using our nutrients, we're continuing to work with fiber. I may add bentonite or charcoal if there happens to be a significant endotoxicity pattern that's present. And we'll bring them out of those fasting days and then slowly start to decrease the dosing schedule. In general, most of my GI cleanse into liver detox programs for patients will last around 2 months. You can do it shorter. I have really healthy patients who like just sort of a spring detox, and they come in and we do, just a good 10-day good GI cleanse that includes some of the liver support. But for my more chronic patients, I have really found this not to be enough. And sometimes that process in 10 days can just be too fast and somewhat too aggressive or assertive for their system if they haven't been following an optimal diet and lifestyle going into this type of a program.
Perfect. Now, the other thing that you mentioned that I just want to call forth to be sure that everybody caught this, you mentioned endotoxicity and having an endotoxicity pattern. How does one know if they have high levels of these endotoxins? Do we just assume that most people are not eating well and we have high levels of these things in our blood?
You can for many patients, and I always first start with the diet and the lifestyle review. So if I'm looking at patterns where patients are and have been consuming high levels of sugar, looking at our simple sugar load being quite significant. And I look back and I see these interesting points, of healthcare concerns that arise out of, say, chronic antibiotic use or prednisone use or excessive hormone use. I look for patterns in a patient's medical timeline to be able to see if there have been the use of medications that have possibly induced a shift in the floral balance within the gut. And then, what kind of symptoms happen to emerge from that point forward? So the classic symptoms I would be looking for that would make me concerned to hunt down and look for the sources or the triggers of the endotoxicity would be things like gas, bloating, indigestion. And also the patients who have very slow and insidious onsets of pain and fatigue syndromes. The majority of those patients I find are harboring an imbalance in pathogenic bacteria, yeast, or parasites, in lieu of looking at their good bacteria. And we're therefore finding that the first pass of detox, which happens in the small intestine and the gut, we see our first pass of detox happens within that digestive system. When those areas have been compromised and GI symptoms persist, those are going to be some of the key things that trigger me to dig deeper and do a more specific assessment.
Excellent. Okay. So, what I'm hearing you say too is that detox really has to be personalized, that people can have a lot of chronic conditions and they really have to be doing this with a healthcare provider. Is that correct?
It's my recommendation if they find that they have a symptom pattern that's linked to chronic diseases. Now, there's one key thing, a very simple thing that I use, and it's called a metabolic screening questionnaire. And it goes in, look at medical symptoms. So I like to look at the medical symptom profile, which is, pretty easy questionnaire to have access to. I like patients to fill in all the different sections, providing me with feedback on their frequency and severity of symptoms, and then look at the big grand score at the bottom of that questionnaire. And whenever that score is coming in greater than 50, I'm absolutely going to be moving in the direction of helping them, giving them some ideas about what we can do to initiate a cleanse and detox. The higher the number, the more concerning. Greater than 100 is usually a scoring that will come in with my patients who have typically these genetic enzyme imbalances that we had mentioned. And they tend to, it's really interesting and kind of ironic that the patients who tend to have the highest body burdens, aka they are presenting in some of the sicker states, the lower state of health and wellness, often require the lower levels of intervention. And it doesn't take often the same doses or the high levels of medical foods or nutrients to be able to really make a shift and start to peel off the layers of symptoms and complexity to their case. So, it's not uncommon, if I have a patient presenting with 20 years of chronic pain and fatigue, diagnosis of fibromyalgia, depression, cognitive concerns, that we begin a very gentle detox. And as I mentioned, I often start these patients on a combination of Advocare and UltraClear. And I'll end up using one Advocare a day, then going up to one twice a day. And amazingly, some patients will respond to a half of a teaspoon of the UltraClear Plus medical foods, and it will give them headaches and aches, and they'll feel like they've got the flu. So a standard dose is 2 rather large scoops, and there's no way I could give some of these patients that full level because of their body burden and their susceptibility. So the sicker the patient, the slower I go. And what I have really found to be my default or my fallback at this point, I like to play it safe with patients this way. I like to go low and slow, lower doses, slower plan. If it's taken us 30 years to get here and developing this chronic disease pattern, we're going to be doing detox in my office for months, if not a couple years. And so we're going to take it low. We're going to take it slow. We're going to start in the gut. We're going to change the diet. We're going to adjust the environmental exposures. We're going to change and reduce the chemical body burden, that we're dealing with. And, come back and do these more powerful, short fasting detox programs once or twice a year. But the whole rest of the year, we're going to continue to support the system, and that every day they're being exposed to various different compounds.
Right. So it's almost, how do you prevent the retox? And so it sounds like what you're really promoting is an ongoing program. Kristi, in the very beginning, you were talking about a personal instance of having somebody close to you not recovering from toxicity. I'm just wondering, with all the patients that you've had going through these programs, on the flip side of that, what are some things that you hear from patients that have really transformed their lives? Have there been any cases or people that have come to you and said that, their life has turned around, they've got their health back? I'm sure that you hear these stories every now and then.
That's the reason I keep going. It's really, truly, hearing hundreds of patients have those experiences. I just, one young man jumps to mind. He's 22 years old. His mother had been a patient of mine for more than a decade, calling me in just a panic because her son in his early 20s had developed this last year out in the fields, a significant tremor. And so he was experiencing a foggy brain. He couldn't concentrate. He couldn't focus. And when we did his medical timeline, the big trigger had been him being out in the fields, driving the tractor and spraying, various different chemicals. So, it was amazing to, be able to point out to them. You realize that this was the trigger in his timeline that set this whole new cascade of symptoms into motion, the fatigue, the aching, the neurologic complications. And we started a detoxification program, very gentle. He's a young man in his 20s, right? So it's not that easy to get them to comply with large doses of medical foods and supplements. So we used a nice maintenance dose, 1 scoop of the UltraClear product morning and night, and Advocare morning and night, and gave him some key foundational nutrients and essential fatty acids, but then basically just stepped back to watch what his body would do with this amount of support. And over the course of the next 2 months, had 100% resolution of symptoms.
Oh, my word.
And here they were on their way for a neurology consult, because, here's the concern emerging that, oh my gosh, my, young son is starting to develop, these symptoms that, require a neurologic workup. And we were dealing all along with neurotoxicity.
That is just so refreshing to hear, that we can really have the capacity to turn people's lives around with this whole process of detox. And again, using nutritional products to help support those pathways in the body. Yeah. Kristi, I'm just curious, just kind of zooming out and stepping back, you're a naturopathic physician, and one of the cornerstones of naturopathic medicine is detoxification. And this is something that you learned about quite extensively in school. And I'm just wondering, why is it that there's such a reluctance or reticence to accept detox in other areas of medicine? Why do you think this is? I mean, with your clinical experience, it's phenomenal what you see, and you keep doing it. That's why you say that you stay in this. But why is it that we don't see a promoting or an understanding of detoxification in other systems of medicine? Do you have any insight on that?
Well, I think one of the biggest challenges, because I work with a lot of healthcare providers too, and I think one of the biggest challenges is the word detox, to be honest.
Mm.
For so long, the word detox was associated with drug and chemical overdose and chemical dependency issues. And, we now live in a completely different medical arena where if you look back a few decades ago, the majority of those who were overdosing because of things like heroin and cocaine and what we would consider recreational drugs. And now today we're seeing drug overdoses are coming from combinations of multiple prescription medications, right? So
Right.
this word detox, to most practitioners is used for this one particular area of chemical dependencies, drug dependencies, or mixed combinations, in which people build up a tolerance, to the meds that they're taking and then go on and drive higher levels or increase their exposures that, may hit in the naturopathic realm the full bucket, right? And that
Mm-hmm.
last drop is, what leads to the bucket overflowing. So I think the word is scary. I think the word means something in that particular arena. In the discussion you and I have been having, and I know the spirit of your detox summit, here, this is where we're actually talking about metabolic detox. And metabolic detox is a different environment. And this is where we're looking at on a day to day basis your genetic predispositions, along with your overall lifelong nutrient exposures and your ability to remove chemicals, compounds, and toxins from your system result in your body burden. And I think the challenge here for all practitioners, including myself, is that it's complex.
Mm-hmm.
What's the patient's genetics? What is their dietary nutrient load like and has been for the years setting us up for this point now, and how well do the elimination system work? This leads to a very unique personal body burden or total toxic load that really puts the doctor in a new position of being a medical detective.
Hmm.
And frankly, it's a lot of work, to take it to that degree. So there are some wonderful, simple approaches, that are good to, I would say, move the needle for many patients. For example, it's a great new book that just came out, The 10-Day Detox by Mark Hyman. These are great things that people can do in general. But when it comes to really the medical management of these patients, practitioners need to learn about genetic susceptibility, these liver enzymes, risk factors, and single nucleotide polymorphisms linked to detox. They have to learn about food. And as you know, and I know, a lot of physicians aren't trained in the realm of food and nutrition, let alone detox support through food and nutrition. And then,
It's
you
true.
go on and you look at that third category of elimination, which has to do with biliary efflux, the impact of the GI function, our capacity to sweat, our kidneys function, and the movement within the lymphatic system. So we've got these 5 organs of elimination, at play too. So you've got 3 major variables that practitioners really ideally could and should explore greater to be able to make an adjustment in patients, health comes outcomes long term. So I think it's overwhelming, to tell you the truth. I think
Mm-hmm.
there's so many variables. It's not easy. It's not one pill, one plan that works for everybody. It's
Right.
it's personalized medicine.
So, if Kristi Hughes had to recoin the word detox, am I hearing that you would call it metabolic detox?
Absolutely. And I
Okay.
think I would call it personalized metabolic detox
Mm.
because, it's not only in the therapeutic interventions, but this personalization also comes through evaluating and exploring the how did we get to this point in time now. So it's medical detective work.
It is, and it sounds like it's quite a journey. Just even going back to your experience of testing the water in your home, so many things that we have to be looking at, the things in our environment, the things that we can't always control. So it's also on us to be educated, which is why we have this summit, so that people know what to be looking for on their own, and then bringing this to a practitioner who understands the art of detox.
And if you have a practitioner that knows what Ultra Clear is, Ultra Clear Plus, Ultra Clear Plus, pH, Ultra Clear Plus Renew, they're speaking in advanced language already of metabolic detox. And, granted, there are functional foods, there are other nutrients that are really tailored towards detox. So I think it's important for patients to really interview and question their doctors and their knowledge, in this area.
And we did talk about finding functional medicine practitioners who, again, are skilled in the art, because at the Institute for Functional Medicine, where you're Associate Director of Education, you're training practitioners in order to do detoxification. So really aligning everybody listening to this summit with practitioners that they can find through the Institute for Functional Medicine.
Absolutely. They can go to www.functionalmedicine.org and locate the Find a Practitioner site, and they hopefully can find somebody in their area.
Wonderful. So, Kristi, we're at the end of our time together. But before we close, I'd like for you to summarize. I mean, you're a very practical, actionable, oriented person. So what are the 3 takeaways that you'd like all people listening to really start to think about and to take into their everyday lives moving forward?
I would say every day eat a rainbow. The phytochemicals that impact the color of our fruits and vegetables all play valuable roles in detox. So, personally, eat a rainbow every day. Second, I would say really learn the updated annual lists that come out from the Environmental Working Group and such, where the Clean 15 and the Dirty Dozen, which then gives you some guidance in when and where should you put your attention into purchasing and working with organic foods. And very naturopathically, you've got to clean the chute, literally. What's going in has to come out. And, more than anything, water, hydration, fiber, good oils, you've got to lube the tube and make sure that the gut is eliminating, because if not, over time, very slow, steady onset of endotoxemia occurs. So make sure that the bowel is eliminating at least 1 to 3 times per day.
I like it. And so many of the experts as part of this summit have been talking about the gut. So what you're saying really resonates with the truth of what so many others are really providing and putting the information out there on. So thank you so much. Kristi, how can people find you, or how would you like them to connect to you?
Well, if they'd like to find me, a couple times a year, I'll do a large group detox program. And I typically will do a 49-day program. It's 7 weeks. And so every day, we focus on certain attributes. We begin with removing and reducing exposures. We focus on the elimination process and the GI restoration profile through the cleanse. We go on and we do a guided detox food plan where we utilize and work with various different medical foods and various products, and then go on into allowing for people to watch and observe and create a personalized plan for maintenance. I do this through one of my group sites on Facebook. So it's under Dr. Kristi Hughes Metabolic Detox, 49 days to get clean and stay lean.
I like it. Well, Kristi, it's really been a pleasure having you as part of this summit. You've got so much knowledge, so much passion. And not only are you trained in the art of detox, but you train others to do this as well. So it's really been a privilege to have you as part of this movement that we have with Detox this summer. Thanks so much.
Thanks for having me.